Hey everybody, Dr. Mark here, and I'm super excited for my guest today, Dr. Tim Young. Dr. Tim, where you from and where did you graduate?
I am living currently in Oklahoma City, Oklahoma. I'm originally from Springfield, Missouri, and I graduated from Cleveland Chiropractic School in 1993.
Awesome. We graduated the same year. I graduated October of 93. That is awesome.
Now, where'd you graduate
And
from?
I graduated from Palmer in October of 93.
Palmer. Okay, good.
Yeah,
My
yeah,
my uncle
Davenport,
was a
Iowa.
chiropractor for oh my gosh, 40 years. He graduated. I think he graduated from Cleveland in 1966, and so it
Who's
was
that? Your
just a
dad?
natural. As my uncle. Yeah, my
Your
uncle. And
uncle?
yeah, and I just, as far back then, I'm from the hills of Missouri. I'm just an old country boy and moved it. And so when I decided I was going to follow in his footsteps, I didn't even know there was another school. Cleveland was the only option. So that's
Sure.
why I went there. Yeah,
Yeah, I get it. And that's awesome. Dr. Cleveland, of course, Dr. Cleveland, Dr. Logan, Sid Williams, they all came from Palmer.
absolutely.
And yeah, so that at one time that was the straight fraction of the profession. And of course, LACC, National, Western States, that was sort of
Western
the other.
states, New York. Yeah, they went
Yeah,
crazy.
but New York didn't start that way. I mean, Reggie Gold taught there. When they were Columbia, they were actually considered on the straight side of chiropractic.
Yeah, it's not that way anymore.
No, 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 it's not. And I'm looking forward to discussing the state of the profession with you. So, do you have a consultant group?
I do. I do. It's called
And what's the
Focus
name of
Focus
it?
Foundations. Focus
Focus Foundation.
Foundations.
I also
Yes,
have
sir.
one too. I also have one too. NTSC Institute. It stands for Non-Therapeutic Straight Chiropractic Institute. So very exciting. So to start off, Doc, what I ask chiropractors that I talk with is how do you define chiropractic in your office? And talk as if you're talking to a chiropractor.
Well, absolutely. The way I define it is I am old school chiropractor. I mean, I've got my green books always on my desk, right? I know the history. I can take you back to the beginning of Cleveland Chiropractic School from, Silva Ashworth. I love this stuff. But through the years of practicing 30 years and here in Oklahoma, I had a great mentor. I don't know if you ever knew Dr. Hugo Gibson. He was my
Yeah.
teacher and my mentor. Hugo, he
Hmm.
just passed. We just lost him.
Very
Um,
sorry.
uh,
Very sorry.
yeah, I'll be speaking at his celebration of life in a couple months. Anyway, so through the years, my practice model is based off of obviously our innate intelligence, our principles, our core principles. But what I've learned in communicating with patients and the volume I've had, I know there's a lot of people who've seen a lot more than I have, but for years I've seen 200, 250 a day, just one room, one table. I don't do the multiple, no marketing, word of mouth, just adjusting. And I've did that for years, but I follow Mark, to answer your question, I follow the paradigm or the principles really as far as communicating to a patient, the principles of physiology. I use X-ray, and I look at an X-ray, and just to make it very very simple. Someone will come in with all their symptoms and all their complaints and all that, and I let them say all that, and then I said, okay, well, what we're going to do is we're going to look to the spine and see what your spine tells me, and then I take the X-rays and I'll look at a lateral cervical X-ray. I'm just using this as an example, and that lateral cervical will have C2 looks beautiful, C3, C4 looks absolutely perfect. You get to C5 and it starts to buckle. We have some degeneration, some bone spurs. It's innately the calcium's growing down to the bone below it. It's trying to fuse. Obviously, there's stress on that joint. Physiologically, that's telling me that's where the greatest amount of stress is. And then
Okay.
subsequently,
Well,
they're
let me ask you,
go
Doc,
ahead.
can you give me a
Yeah.
definition, like, for example, as the Green Books, like Stevenson, can you give me a definition of chiropractic? Ultimately, this sets our scope of practice.
Yeah.
Wow.
So in
How do
my
you define it?
so how do I define chiropractic is looking to
Yeah.
the spine to find the greatest amount of stress in the spine. Stress is caused by whether it's mechanical stress from an injury or universal stresses. It restricts the joint motion. When you restrict proper joint motion, it irritates and inflames the nerve tissue. The brain cannot communicate to the tissue cell appropriately. Our job is to restore and maintain motion in the joint long enough to allow that area to heal. And then that end result, the transmission returns. That's in a nutshell of what we do.
And are you seeing how this is a challenge to define chiropractic? I think this is one of the big issues that we have in chiropractic is we don't have a clear definition. And so let me ask you this, with that being said, because that is a bit mechanistic, is there any room in that definition for something to say that I think is a solid part of chiropractic, vertebral subluxation?
Well, absolutely, Mark. I'm a huge believer in vertebral subluxation. That's what I
Okay.
learned. Yeah,
Okay.
but here's the
So
thing, though. You and I can talk about that.
that's
But
what I said.
Mary,
Yeah, talk as if you're
Mary, that's a
talking to a
school teacher
chiropractor.
that comes in is not going to. Yeah, so
That's not what we're talking about. We're
I
talking,
work with.
I
Yeah,
said, Tim, talk as if you're talking to a chiropractor.
okay.
So
Oh,
that's what I'm saying.
I'm used to having to break it down to people who've never learned chiropractic where they actually understand it. So
Yeah.
there is absolutely vertebral subluxations. There's misalignments and restrictions of the joints in the spine that is blocking the transmission, interfering with innate intelligence that and is in all of us that actually expresses to maintain balance and homeostasis, adapt to our environment. Really, in a nutshell, all the subluxations do is interfere with the body's ability to adapt. Let's make it simple.
Okay. I
And
mean,
our
we're
job
getting
is to remove that
closer.
interference.
Okay. Remove it or facilitate an adjustment of vertebral subluxation.
And I say that a lot. I'm not big on these guys that do like curve restorations and they correct scoliosis we're not correcting anything. What we're doing is we're intentionally introducing motion into the joints of the spine. Innately, the body is going to do with it what it sees fit. Now, in principle base, our intention behind that, I think, is just as important as the actual adjustment itself. And that's where I'm somewhat controversial in the profession. And I know as you are, we have our paradigms and our principles we live by. I believe the intention is just as important the adjustment itself, right? And so
And
that
what's
no
your
one wants to
intention?
talk about that.
And
My
what, no, we
intention
talk about it
is
all the time.
yeah, but my intention is to when I make the adjustment, it isn't to make somebody feel better. It is to, like you said, facilitate the body and allowing the removal of that interference. But I expect that the brain and the body can heal itself of anything known to man with that adjustment. Now, did I tell the patient that's going to happen? No. Do I expect it? Yes. That's where I'm different.
Every condition in the world.
Doesn't matter. It has the ability. Now, like
Okay.
Reggie said, and just like Reggie said, the power that made the body heals the body. No, it doesn't.
No, that's not what he said. No, that's not what Reggie
Well, he
said.
said no, he said no, it doesn't. He said it
Right.
can, but it doesn't have to, is what he
Well,
said.
it says
And
sometimes. No, what he said was sometimes. So
so
so let me clear some things up. Let me clear some things up because I appreciate your straightforwardness. When we look at results, we have now stepped into a medical model of chiropractic. So there are two models of chiropractic. So if we're going to be clear, there is a therapeutic model of chiropractic, which is concerned with results. Then there is a non-therapeutic model of chiropractic. And in this model, we define chiropractic as the analysis and the facilitation of the adjustment of vertebral subluxations because they, in and of themselves, are detrimental to the expression of innate impulses and trophic impulses. Chiropractic is all education toward this objective, and chiropractic is nothing else. So when we're looking at the two models of chiropractic, we have one model, which is the vast majority of chiropractors that practice in the B.J. Palmer, D.D. Palmer, getting sick people well model. What happens is this, as you know, the body is a very complex and complicated thing. So when we're looking at a fuller expression of life, your body has functions we don't even realize are going on. And because the theory of the vertebral subluxation, we have different theories. If we read Dr. Robert Leach's book that's taught in most schools about chiropractic theories, we have theories that go into what BJ talked about, the upper cervical spinal cord, base of the brainstem medulla oblongata. We have the total brain and spinal cord pressure. We have pressure on the nerve roots. So where the difference between therapeutic and non therapeutic chiropractic happens. Non-therapeutic chiropractic says it is impossible for any chiropractor on the planet to predict exactly what physiological function will improve. But what we can say with absolute certainty is everybody lives better with a fuller expression of life, with a fuller expression of innate impulses. And that is absolutely certain. So I think where we want to clear up misunderstanding. Folks who are attracted to the non-therapeutic model are attracted there because of their incredible understanding of chiropractic basic science, which, as you know, was brought to us by Stevenson in the 33 Principles, which Claude Lessard geniusly has removed from a philosophical concept to a basic science concept. And then second, the chiropractic philosophy of constantly asking why. So the non-therapeutic chiropractor is held to the highest standard in chiropractic in the ability to reason every single analysis that they do, to go over the congruencies and incongruencies of every analysis, and to look at the result that every chiropractor really idealistically should have. And that's the adjustment of vertebral subluxations, the adjustment the chiropractor does not make. You alluded to this, that the adjustment happens when, see, because we never know what innate normal is, and that will be the issue with every profession that works with the human body. We do not know what innate normal is. And with that being said, the thing that every analysis should have in common, the one thing to figure out what the innate law is trying to do with the presence of that vertebral subluxation, and analyze what the innate law is trying to do to determine, one, the existence of a vertebral subluxation and the vector in which the innate law is trying to make the adjustment, educationally placing an external concussion of force with the intent that it's turned into an innate force, which will bring that vertebral subluxation back to innate normal. And how do we know that that happened? Through our post-analysis. So when we look at chiropractic, there isn't three models of mechanistic, vitalistic, and non-therapeutic. You were very close earlier. It's the objective. If your objective is to get sick people well and have results, you're now practicing an alternative to medicine and therefore need to be held to a medical standard. And this is why within every school, it's moving to a medical form of chiropractic. That chiropractic is an alternative to medicine. And if our intent is to get sick people well, logic will dictate that we will incorporate many things to get sick people well, because it would take many things and to keep the well from getting sick. If we look at chiropractic and where DJ, and Stevenson, who I'm so thankful for, they didn't have everything figured out any more than Benjamin Franklin had everything figured out about the principle of electricity. But what they did set was a groundwork that if we focus as chiropractors exclusively on the adjustment of vertebral subluxations for a better expression of life and checking spines on a regular basis. In my office, it's weekly for life. We simply disassociate from any physiological outcome that you, me, or anybody on this planet could possibly predict, but have the absolute certainty, as Reggie said, that everybody lives better when vertebral subluxations are adjusted. And there is a massive responsibility for the non-therapeutic chiropractor in basic science, in applied science, which is practice, and in our understanding of the philosophy, which ultimately sets our scope of practice and our education in our offices.
So when you say, and I agree 100% with what you're saying, but there's a little bit, and I say this very respectfully, but when I'm listening to you, and if I'm hearing it, there's a little bit of a contradiction in this, even what Reggie said. And I love Reggie. I'm a huge, listen, Irene Gold is a person close and a friend of mine. I give her an award at I have a big conference every year. I give her an award, the Millions Tomorrow Award. So I love Reggie. But when you say that our intention is to remove, or basically remove subluxations, vertebral subluxations,
I
for the
wouldn't say it that
expression
way.
of
I would not
life.
use that term, though.
Well,
Facilitate the adjustment of vertebral
facilitate.
because we got it. Yes, we
So
facilitate the
what's the
adjustment of
intention
vertebral
behind it?
subluxation. The
What's,
intention is that vertebral
yes.
subluxations are always bad because they interfere with the expression of innate impulses. That's huge.
Okay.
That's massive. And the intent is the adjustment for a fuller expression of innate impulses, which simply means the body is going to live closer to its full potential. And yes, Reggie's been dead now for 15 years. Chiropractic continues to evolve. And unless you're studying these, and Claude Lassade, I highly recommend, he took Stevenson's and is breaking it down into 5 books. Each chapter, or each book reflects freshman, sophomore, junior, and senior as it is in Stevenson. Because here's the thing, we know more than they did in 1927, Dr. Tim. We are expected to understand this and have an articulating knowledge of the 33 principles and the normal complete cycle. The intent of a chiropractor, and this is very easy, and this is where my institute teaches chiropractors how to communicate this value of what we have, that vertebral subluxations are unbelievably bad. And chiropractors are the only profession that studies the depth of vertebral subluxations. Yes, I wish DD came up with a different name, but he didn't. So that's what we deal with as chiropractors. And we have one intent, the adjustment of vertebral subluxations for a fuller expression of life. Nobody can predict which physiological outcome is going to improve any more than I could predict where broccoli is going to go when I eat it. But logically, it's one of the most powerful investments any human will ever make in themselves and their families. We work with the metaphysical concept, Tim. Chiropractic beautifully acknowledges that. We cannot measure it and we cannot make physiological predictions. But what we can say in every circumstance is 8 billion people live better when vertebral subluxations are adjusted for a fuller expression of life. And that in and of itself justifies the need of chiropractic for every human being on the planet.
So, and I agree 100% with what you're saying, but I'm going to be the devil advocate is, and you and I can, you and I can do this all day long. And I'm your cheerleader, man. I'm right there with you. Expression of life. You know, that's my daughter's a chiropractor and she sees over 200 babies a day. And when she says our job is to amplify life, that's her paradigm. But you and I can talk about this, but if we're going to articulate this to the moms and dads and the in my world here in Oklahoma, the guy that comes in off the oil field or the school teacher or these people, if they're going to understand this, now we're talking about a different paradigm, right? Because now we understand that, we carry that, we own that. But I'm gonna give you this. I'm gonna give you a scenario, and this happened about 14 years ago, 15 years ago, because this young man is getting ready to go be a chiropractor now. But I go into a hospital in ICU. I have a baby in an ICU that was told that the parents were told that this child will not make it through the night. By God's grace, the only patient that I had at that time was a pediatrician, was on call on that floor at that moment. And they asked, could Dr. Young come and do something? And he told them, if he can do anything, tell him to come. We'll get him in because at this point, we don't know what to do. He won't make it. I'll make it a long story short. I get there. It was a forced delivery. They ripped him out of his mother. He's laying in an ICU. He's laying in an ICU, Mark, and all the blood vessels are exploded. He's got all the monitors. There's me, mom, dad, and 4 nurses. We witnessed this, and so I come in. I look up the heart rate. The heart rate on the monitor is over 200 beats a minute, and the respiration is about 6. Right? He's not got much time. And they don't know why. I reach through the wires, I pick him up, I take my thumbs, I palpate, 5th thoracic rib on the right, bam, I said it, but you could hear it. I let him down, his little atlas was sitting so far sideways, it was pushing the skin. I set the atlas, I turn him, he turned his head, he takes a deep breath, and he takes a breath. The heart rate starts coming down, the respiration starts coming up, normalized. Of course, there was an old nurse with her arms crossed, pissed that I was there, said, well, those machines aren't reliable anyway. But we all witnessed the result of a chiropractic adjustment. Now, had I come in and I made that adjustment and there is no change, then those parents and the people watching that have no proof of chiropractic. Yes, he expressed life better, but he still didn't make it. We still, at the end of the day, when somebody leaves our office and if they're going to express life, we understand the philosophy. They've got to live it. They go back to their normal day-to-day world, their normal day kids and soccer practices and life and bosses. And at the end of the day, when they get up in the morning, do they get up crawling out of bed or do they get up better? Do they have a migraine headache? Do they beat their kids or not because of a chiropractic adjustment? So at the end of the day, yes, you're expressing life more. Yeah, but I don't see any results of it. So what good are you to me? So yes, we adjust vertebral subluxations. We facilitate and allow the innate intelligence to correct. But in a real world scenario, the people that are coming in out of my office, they want freaking results or they're not coming back. Now, yes, you could spend an hour trying to educate them, and some will get it and some won't. But I just in a paradigm is 30 years of practice and all that I've done in this city, right? I'm known, go see doc, he will help you. And that help is the expression of life, but there's got to be a tangible result for them to understand. Just like that parents, now that young man's going to be a chiropractor because we saved his life through a chiropractic adjustment. So if that makes sense, yes, I agree with everything you're saying, but we've got to be able to articulate that in a different way, in my opinion.
Okay, and this is where we're going to disagree. And I have a whole institute that teaches this because I've been practicing in this model since 1997. And here's the thing, that's great, and I love that that happened to that situation. You could not predict that any more than I can. And
And I
the
did,
fact that that
and I didn't
happened,
try to predict it.
I understand that. So this is where it's going to come down. The issue in chiropractic, where you were bringing, is that all these schools, like you said, are teaching all these medical things, and these kids are coming out with a less and less chiropractic education. And I'm giving you the core root. I think we're obligated to do this. I think we're obligated to be honest with everybody that we take care of, and people can accept or reject me based on that truth. The better I am at articulating that, the better I am at creating value, the better I am in assisting them in making the best decision possible. That's what I teach on my platform, and it's vitally necessary. Now, does everybody sign up and come with me? No, I'm not everyone's cup of tea. If I were to
Yeah.
mislead them, to say that, oh, I can predict this, I'm not going to do that because I can't predict that. But what I can say is this. There has to be an element of trust, and trust comes from being 100% honest. I think we both agree that if somebody comes in and they had a horrible cancer, they live better without vertebral subluxations, regardless if that cancer goes away or not. I want them to pick what I do based on truth and honesty. If they choose not to, simply because I can't predict a result any more than you can, um, then I'm willing to let them go. And if they want to come back later, great. Now, here's the thing. Because if you're looking at results, that's part of the issue why folks, our schools are teaching in the medical model. Because why wouldn't you incorporate more things to get better results? It only makes logical sense. And what's the sacrifice? Understanding chiropractic. You know, I would take that story a step further. My intent mission is 8 billion people being checked weekly throughout their life. I want it to be ridiculous to think that you live life without the habit of chiropractic. We're not going to get there looking for results. We're not going to get there treating symptoms and being an alternative to medicine. We will only get there when the common sense that vertebral subluxations are unbelievably bad, everybody has them, they can happen from birth, and the only way you know if you have them and to get them adjusted is to see a chiropractor. The only way we get to this knowledge is to understand chiropractic principles, is to stay true to them, is to constantly evolve in our understanding, and then to deliver the service that we promise. So yes, we do disagree on this. And yes, Reggie Gold, Joe Strauss, Joe D'Onofrio, the three pillars of chiropractic have all passed. And if we don't study chiropractic, we're going to miss that evolution as well. We're further along than what Reggie was doing, and we should be. Do I think Reggie's triune of life holds to the test of time? Yes, way better than Reggie's third paradigm. I do not agree with the third paradigm. There are two models in chiropractic. The only two schools that are close to the non-therapeutic model left in the world. It's not Cleveland, it's not Palmer, it's not Life. It is Sherman College and it is New Zealand College of Chiropractic. We tried to get a straight chiropractic accreditation, SCAZA. I'm sure you remember that. There were three straight
Yes.
schools left. It was Pennsylvania Straight, there was Sherman College, which there still is, it's the only survivor, and then there was South California School of Chiropractic. The two are gone. Sherman's the only one left. You needed 3 schools and a straight organization. And what's left of the FSCO that Reggie created is the Chiropractic Trust, exclusively focused on the adjustment of vertebral subluxations for a fuller expression of life. So the non-therapeutic model are folks who have an incredible understanding of chiropractic principles and philosophy and can apply that in their office with massive communication. Dare I say it's the chiropractic elite in their understanding of chiropractic principles. We're not talking about technique here. We're talking about the understanding and the application of chiropractic principles. As long as chiropractic stays in the medical model, Tim, our schools will continue to go down the medical trail, and chiropractic will become more and more obsolete. And I will be the outlier, crazy person who happens to be chairman of the board of a crazy organization that understands and applies chiropractic principles.
Yeah, and again, Mark, like I said, we're probably 99%. I agree with you 100% on about everything. And I'm going to be in New Zealand in May, and I'm in Sherman a lot. The new president's a good friend of mine. I'm down there teaching, speaking a lot. If we have enough time, I'm going to give you a quick scenario, and I want you to evaluate and tell me this is how I approach things. And I agree 100% what you're saying, but this is how I approach things. I'm doing a consultation with a new patient. And I always ask, tell me what's going on. Obviously, they want to tell you, just like everybody did. They bring their symptoms to you. And then I simply tell them this. I understand that the pain brought you here. But if all you cared about was pain, I would send you home with a handful of Advil and a shot of tequila, and you'll feel great. That's not what we do here. All right. What I'm going to do is take some pictures of your spine, and we're going to look to the spine to see where the level of stress in the spine, where the lack of motion is. That's what I do, is look for your spine to tell me what's truly going on the inside. Is that okay with you? And then they agree. Then I never, ever, ever ask them how they're feeling. I never bring up their symptoms. I never bring up their pain. But what I do is I educate them on the restricted lack of motion. The subluxation is this restricted joint motion that causes stress on the tissue. Physiologically, you can't argue it. That's exactly what it is. If that wasn't the case,
I could argue that. I could argue that, but keep on going.
Then why would there be no reason to put motion in it if it didn't need it, right? So it's restricted in motion, and we're restoring the proper motion. That's my paradigm. That's my philosophy.
I'm just saying that I could argue that, but go on.
So then what I do is when I look to the spine and I find the greatest amount of stress physiologically evident, it shows right there. And then when I start introducing the motion into that joint and maintain that motion long enough, my intention, I don't ever ask them how they're feeling. I don't tell them that we're going to cure anything or fix anything. But then I continue to adjust, and I allow NA to do its job. NA is going to teach that patient way more than I. And I teach that to all the doctors I work with. You don't have to educate them. NA will educate them. They will tell you when they get up and when the expression of life has, like you say, we're going to increase the expression of life. We're going to facilitate the expression of life. When that happens, there's evidence. If there's not, if they don't notice anything different in their life other than you said that this is good, they're not going to continue doing it. I listened to your podcast very, very closely, and that's what he kept coming back to. It's like, well, if I'm not, yes, you can say that my life is expressing it fuller because I'm getting adjusted. If I don't know it, I don't care what you say. And that is the normal human being, right? For the most part.
Well,
and so
yeah.
I don't go into it with the intention.
If you watch that podcast at least 3 or 4 times, he said, I am ready to start chiropractic. Here's the thing. First of all, there's an agenda on an interview like that. You know that. You've been on some high-level interviews.
Oh, I know. I was surprised you were on there. Yeah.
Yeah. So, but more than a few times, he's like, I'm ready to start chiropractic. If somebody says that, okay, now we're ready to start the true education. So here's the thing. Education, and you know this, Tim, it begins on the first visit. It doesn't stop there. So you are constantly educating folks on the non-therapeutic model. They're bombarded with medicine and therapy every day. They're going to hear about all
when they walk in. Yeah.
100%. And a few things on this. One, The more we incorporate in chiropractic, the more we dilute chiropractic. There is only one place people are going to hear about vertebral subluxations. That's our offices. And anything we do outside of that, we're doing a disservice because they're not going to hear about chiropractic anywhere else on the planet. Second, when you practice long enough in this model, people will start coming in for a better quality of life. Not every single person, but there's a significant amount of people who say, look, my family's been coming in. They love coming here. I want to get started and I want to bring my family in. Consistency always pays off. I'm not telling you anything you don't know. In the end, if people want symptoms to go away and they're fighting me on it, Tim, I'm like you, bro. I'm a happy guy. I've been in practice 33 years. I go 7 days
Yeah.
a week. Either you love what I do, and I'm going to tell you this, I do not try to sell people who are not a good fit. If you love what I do and you have joy and enthusiasm for this message and this service, I'm your guy. Anything less, I'm saying, well, you know what? Let me give you some information. Take it home. Because unless somebody is joyfully excited, I'm not your guy. There's 17 other chiropractors. Do I think chiropractors should be paying me commission for all the people I said? Yes, I do. Do they? No. Because I'm not somebody's guy. So believe me when I tell you, I am vetting people when they come in here for enthusiasm. Is this somebody open to be taught? Is this somebody appreciative of this opportunity? If the answer is no, I pass. And I'm totally okay with that. Chiropractors have got to be strong. And as you've seen, it's very difficult for chiropractors to define chiropractic, which is ultimately our scope of practice, which is ultimately why schools are going down a medical model on a massive level. So my office for 30 something years, well, my 29 years, because 30 years this year I'm going to be celebrating in one office for 29 years has been built on the non-therapeutic model. I live to say that it's possible. Do I need to do consulting? No. Do I need to go on Bradley? No. Do I need to travel the world? No. I do it because I love chiropractic. Eddie Weller was asking me the other day, do you ever get tired? No, I love this. I get to do this every day. I get to be absolutely straight with people and help their bodies adjust vertebral subluxations for a fuller expression of life. And life is always positive. Life is always happy. And you know what? If I just decided I'm just going to practice in my offices and live out the rest of my life, make lots of money, helping people live better, that option is there. But I don't want to do it. My legacy is people having the habit so you don't have to sneak into an ICU because everybody's getting checked. Every medical personnel realizes we all have vertebral subluxations. Thank God chiropractors are trained in this. Let's make sure everyone has this habit, not as a crisis, not as a treatment, but for longevity.
Man, I'm right there with you. I'm on the same mission. I can show you my calendar right now. I got 7 countries I'm going to this year. I'm doing the exact same thing. I didn't have to do it. My practice, I'm very, very successful in my practice. I've, I my the dynamic and what I've created in the last 30 years. The end of next month is my completion of 30 years. And so,
Wonderful.
I've been through a lot, just like you have in this profession, man. And I've been worldwide. Like I said, I got 6 countries I'm going to, and teaching technique and philosophy and the practice model. I didn't have to. I didn't have to do that at all.
I
But
love
but
it. I
here's
love it, Tim.
but Mark, or here's what I believe, that this profession has given us so much, and it is our responsibility to give back. We had a continuing ed seminar yesterday. I started our state association about 12 years ago. And yesterday was the largest meeting we ever had. We have the largest state association in the history of Oklahoma right now because of the things we're doing, giving back to this profession. So I'm right there with you. My sword is drawn and I'm fighting right there with you. One of the things I love about being able to spend some time with you is that we can have this discussion and we can be brothers and love each other in this profession. You
Yeah.
can't do that everywhere. You can't do that
Right.
everywhere. Everybody's got an agenda and a stick up their ass. And if you don't, lay down in front of their parent, then they don't have any part with it. You and I are
Yeah.
on the same mission. We're fighting the same fight. We come
Mhm.
from different backgrounds, different perspectives, different teachers, different this and different that, but our mission's the same. Our mission is the same: is protect the sacred trust. And I really believe that in my heart. And so I'm honored to be able to have this discussion with you and hear more and express more with what you've got to say.
Thank you. Thank you. Very, very classy, Tim. Very classy. So as we wrap this up, I'll tell you what, let's try to meet again. Maybe we'll do this in 6 months down the road when you get back from your world tour and we'll continue. Okay, buddy?
I'd love it, Mark. Man, have a blessed day. I truly appreciate you and all that you do.
Thank you. Thank you. Very classy. Thank you so much, Tim. Very kind. And thank you for taking the time to come on this conversation. Much respect. And I look forward to talking with you soon.
All right, brother. See you soon. Thanks, buddy.
See you soon. You too, buddy. Bye bye.